The 10-Minute Medic, an expectation guide for mass casualty incidents and triage for HCFR personnel during the first 10 minutes of the event. The HCFR Training Division has developed the 10-Minute Medic course with the standalone engine paramedic in mind. In this segment, we'll identify the basics surrounding the initial recognition and management of an MCI and the subsequent triage of patients. Hillsborough County is a large, very diverse area. At any time, a mass casualty incident, known simply as an MCI, can occur. MCIs aren't planned, and they can quickly overwhelm the allied healthcare system. We all know we're long overdue for a large event. As such, we must train for and expect an MCI to occur in the rural, urban, suburban, urban interface, industrial, and water setting, or in any combination of the above. What is an MCI? The Hillsborough County Emergency Management Plan defines an MCI as any incident with 15 or more patients, each with unstable vital signs requiring emergent advanced life support, or when a large number of lesser injured victims with unstable vital signs or injuries require examination and/or treatment. Living in Florida, severe weather is our reality. We live in the lightning capital of the country. A lightning strike or flashover can easily injure many victims at a time. Additionally, we are often at risk of tornadoes and other violent weather systems. Take a few minutes to consider some of the vehicular MCI possibilities within Hillsborough County. Interstate 275, I-4, I-75, the Selman and Veterans Expressways, along with many numerous miles of high-speed surface streets, can all have the potential for high-mechanism mass casualty incidents. Infamous shootings go by the name of Fort Hood, Phoenix, Tempe, Arizona, Virginia Tech, Columbine High School. Locally, recently, the city of Palmetto had 22 shot in an MCI. Our reality is that active shooter events happen. Hillsborough County and the cities within our boundaries host several large events every year. Any one of these could result in an MCI requiring our involvement. Hillsborough County is a large and geographically diverse area. There are many industrial entities that can set the stage for an MCI. These include portions of the port, hazardous material transport, and the Tampa Executive Airport. Every MCI is different. A multitude of factors that are as broad as traffic patterns and congestion to wind speed, humidity, cloud ceiling, and individual hospital capabilities affect our operations during an MCI. It's vitally important for all HCFR rescuers to understand how the START system of triage works. When an event meets MCI criteria, begin the START triage process. START stands for Simple Triage and Rapid Treatment. The START triage system is relatively easy and quick to deploy. The first category is deceased. If a patient presents with no respirations after a head tilt, the patient is considered black or deceased. The next category is immediate. A patient is tagged into the immediate category if their respiratory rate is over 30 breaths per minute, their perfusion is delayed, as evidenced by capillary refill of greater than 2 seconds time, or they have altered mental status, evidenced by the fact that they are unable to follow simple commands. The green category is considered walking wounded. If patients are walking around and stable, they're tagged into the green or minor category for walking wounded. The final category is delayed. These are patients with otherwise simple, non-life-threatening injuries that are not considered walking wounded nor immediate. The person doing the initial START triage does not fill out the tag, with the exception of placing the time on the tag. Rather, he/she only tears off the color strip and attaches the tag to the patient. After triage is completed, transfer your patient to the treatment and/or transport groups. Today we've discussed several MCI scenarios that, if not managed appropriately, can quickly overwhelm us. One atypical presentation might include a school bus accident. The HCFR pediatric protocol requires any patient less than age 14 to be transported by advanced life support when the call level is initiated as a D-level response upon dispatch. As we conclude this edition of the 10-Minute Medic, take a second to consider the initial patient surge when you arrive on scene of an active shooter MCI, a bus accident, a large event related to the Republican National Convention, a lightning flashover at a picnic, or possibly 20 or more patients stricken by an organophosphate poisoning. Are you ready for START Triage? Do you understand START Triage? If there's any doubt in your mind, go out to your truck, find your START Triage tags, and begin practicing now. The 10-Minute Medic, an expectation guide for mass casualty incidents and triage for HCFR personnel during the first 10 minutes of the event. Thanks for listening.